In this talk, we are going to look at heart failure with reduced ejection fraction. So, unlike heart failure with reduced ejection fraction, where you have to diagnose along with the ejection fraction with symptoms and signs plus the BNP and other parameters, if your ejection fraction is less than 40 and you have symptoms and signs of heart failure, then automatically the patient comes under heart failure with a reduced ejection fraction. So, to give you some classification, I told you that about Indian scenario with a classification. So, this is a huge registry from the Trivandrum, Kerala and Trivandrum Heart Failure Registry. What is the 90-day outcomes of heart failure patients who are getting discharged from the hospital? So, as you can see that the heart failure mean age is likely to be 61 and 1/3 are women, and we look at the acute onset first heart failure is 40%. The most common etiology for heart failure today in India is ischemic heart disease, followed by dilated cardiomyopathy, and of course rheumatic heart disease is the next thing, and also the hypertension 11% miscellaneous. So, most common cause of heart failure today in India is ischemic heart disease. So, we already seen this classification of heart failure, and we tried to explain that in the pathophysiology diagram. So, I told you heart failure with reduced ejection fraction is symptoms and signs with the EF of less than 40%. We have told you about the stages and also the functional classification. Most of the patients with the heart failure with reduced ejection fraction will come under C of staging, and 2, 3 or even 4 of functional staging. So, this heart failure with reduced ejection fraction, whereas heart failure with preserved ejection fraction may have even stage B or so. Now, you can see the mortality are the patients more than 45 years, and establish the percentage, the prevalence, and also the at what stage they are in. So, the stage A heart failure is 22%, asymptomatic is 34%, symptomatic heart failure is 12%, and refractory heart failure is 0.2%. So, you can see that the majority of people are in these two groups, that is at risk of heart failure or already